to have put a mask on. Okay, I would suggest just putting it on both of these whenever this has to be on no matter what. This technically has to be on during the case, but I would be putting this on while you're setting up because you never know if you're going to have opportunity to break scrub and re-scrub before the patient comes in, or they're just going to roll them in while you're still setting up, which happens a lot, right? So this is a case cart in itself. This is like exactly what the hospital has. Not every station has that. We have those that kind of like makeshift ones. This would have all your supplies that you need in it. So on the inside of this, I have my back table pack. Show everybody. I have a back table pack, I have a basin set, and I have a set of instruments. Okay, all that has already all of that is already pulled for you, right? Along with this stuff. That's the stuff that's ready for your specific case. So that all, while it's clean, it's going to have all that stuff. At the very end, when my instruments are dirty, I'll put them back in here. These doors open, and they'll lock in the front. And then I'll switch this to a biohazard, and that's what I'll transport them to sterile processing. Right? That's the correct way to do it. So the first thing that you ever have to do, and it's usually at the beginning of the day, you have to do what's called a damp dust, in which we have to wipe down all the flat surfaces of the OR because there can be dust and all that stuff like that. Especially like the top of the OR light never gets cleaned. So you'll be in the middle of the OR, or the middle of a surgery with the patient open, and they'll move this thing and dust will just start flying down to the patient. You can imagine that's not probably very good for them. Do not touch these gloves without, these wipes without gloves. It has a picture of a baby with a line through it, so that can't be good. So, yeah, I know. So, the one thing you want to start, basically the rule of it is you're going to start from the top of the room and work your way to the bottom of the room. And then typically you're going to work your way on the inside of things to the outside of things, right? So really you would start with like the middle of the light, working your way to the outside of the light. In the OR you would have two lights right here, but we're kind of spread out. Then we can go one level down, which will be this Mayo. I'm in the middle of the Mayo, working my way to the edge. On the table, I'll start in the middle of the table and work my way out. Still staying the same height. I can watch through the top of this.
We're doing this with the same white?
Yeah, here it's fine if it dries out, whatever. It's just practicing doing the thing. But in real life, if this dries out, do another one. You got to limit it in there.
I have a question.
Yeah.
You can wipe this part of the mouth?
Yeah, you can wipe your bottom. Got that. Yeah, perfect. So then we'll work our way down. So it's kind of the legs of everything, right? So like this is your Mayo stand. We'll work the legs of the Mayo stand, the legs of our table, all the way around. Our ring stand. And I'll get this thing out of the way in a second so you can see better. We'll do the legs all the way down, and then we got to do the bottom of everything. So here's the bottom of that, the bottom of that. We'll do the bottom of the table, put the point on that. You don't need to wipe the bottom legs on that. So that's everything wiped down. And if there wasn't a patient, obviously there wouldn't be a patient, we'd also do the bed when it came time to do the bed, right? So all those are good. Now we're going to do what's called spreading the room. Basically, we're going to take all this stuff and put it where it needs to go. Where it goes is important, okay? This is our back table pack. Has a bunch of stuff, towels, gowns, a bunch of stuff in it. They can go right here. We're not opening it yet. Our basin set on the ring stand. Our instrument set on our prep stand. And then you could leave this here, but we're going to move it out of the way just so that, we're going to move it out of the way just so that we can see what's going on. So I would need something this way. So, now that everything is spread, one last thing is your gown. You won't open your gown yet, but we'll at least put our gown on our Mayo stand like this. And we'll go ahead and position. Do you see how it's positioned like this? So later when I'm putting my gown on, I'm not close to my table. So it's kind of, if you have it like this, when you come to put your gown on, you see how close I'm going to be to this, and this is going to be sterile, right? So where I'm putting everything is also really important. Okay. So here's my, well, I'm going to use real gloves so you can see what it looks like.
Wash.
Yeah, so you have all this stuff. Technically you would do your hand wash before you did all the wiping and stuff like that, right? Just like a basic hand wash. But you should know how to do that. The scrub part I'll show you in a minute. In case you didn't know how to wear one of these masks, this has metal in the front. So you can kind of pinch it and kind of make it for your nose, or you can put it on your nose and pinch it. You're gonna tie the top strap to the top, and the bottom one can go low. That way it stays on. If you're tying them both in the back, your mask is just gonna keep falling off, right? Let's see, I want to wear these, but we're gonna put these on. So now we're gonna open. The first thing you want to try to do is make your sterile field as wide as possible. And then we're going to bring it all back in. Our back table cover, folded like this. We want to open it all the way side to side, and then we'll open it front to back. Okay? So that means I'm going like this, all the way open, like this, all the way open. This next part is kind of where half of you will get points off on your final, even though I'm telling you right now. We can change it, but we'll see. Now it's front to back. So now this whole thing is going to be sterile on the top, like I was showing you in class, right? You're going to grab the very bottom of it, and you're going to go out, and then you're going to drop it. Now, I have to walk past this. This corner is sterile. How far away from the corner do I have to be? 13 is solid. 12 is the max, right? 13 is good. 20 is good, right? More than 12. So what I see a lot of people do, I'll show you first how to do it. I'm gonna walk, this is not sterile. So if this is in my way, I'm just gonna move it, and I'm gonna make sure I'm 12 inches away from that. On this side, I'll show you what most people do. I'm gonna grab the edge of these, open it up. Still good, I still stay far away. Most people are like this, okay, and then they just walk like this. They're this far away from the edge of their table. It's gonna happen to probably all of you at least once. Try to not let it happen. As far away as you can. You want to move this thing, get out of the way. Even though you might be good at not contaminating, when you're at your clinical site, it's about showing your preceptor that you know what you're doing. So even if you walk like this, and they're like, you're too close. You didn't even see how close you were, you're not looking. Look at the corner and like walk around it like this so you're not too close. And then we can put our stuff back. So this back table cover was wrapped up, right? So, and all the stuff that's wrapped needs to be opened first. Okay? That was wrapped, let's open it. This is wrapped, I'm gonna do it in the middle. You would do it right here, okay, remember, so I can show y'all. This is wrapped like a gown with the flaps. Remember what the first flap is that we do? Away from you, right? So there's the first one, away from you. Here's the sides. The last one is towards you while you kind of step back, and I was never 12 inches or closer to that, right? Now, this whole thing would happen over there. So when you're doing the sides, be careful. I'll just show you. When you move this, you either have to squat down, you have to use your feet, because you cannot get too close to it, right? When you're opening it, if I was doing one of these sides, it's pretty easy to just, like that. And I touch the edge, and then that edge touches the table, right? If I didn't, everything's good, and we will take this. This is the same height as our table. So we can literally put it right next to our table. Nothing's contaminated, okay? The next thing, everything that's wrapped. In this bucket, you have laps and you have Ratex. These are both surgical sponges we can use to soak up irrigation or blood or anything like that. These are wrapped, so these go next, okay? But we don't put them down and open it like a gown, but we follow the same rules. This is my first little flap, like that. First flap away from you, right? So I'll take my thumb and I'll put it right underneath that flap like that. And I'll go away from me. And when I do that, I'm tucking it into my fingers like this and holding it because I don't want it to flop around. Same thing from the sides. I'll take the side and I'll hold it. Take the other side and I'll grab it. And the last one towards me, I'll hold on to this one because I'm going to come over here 12 inches from the front, 12 inches from the top, and I'm going to drop it on there. You see how none of it came undone? You'll open it at one point and it will look like this. Look how close that went, right? That's why you're keeping it all in your hand. Go back up. We're checking for holes. For these, we reuse these, don't throw them away, but in real life, you throw it away, right? You're good. Same thing with the Raytech. Take your first little flap away from you to the side. I don't want you to reach over and do this because you're getting close to this, so you'll go underneath. And then towards you, come over here like this, drop it, back away, And then look, and no one likes anything flapping. Don't flap around because there could be dust or anything that flops. So when you do it, just open it up, look for a hole, there's no hole, and we'll move on. That's all the wrap stuff. The next thing that we're gonna do is all of the peel pack stuff. I'm gonna go behind the table just so you can see how I open it, but you would open it just this way, okay? This peel pack things, they're sterilized in this. The corners of this are sealed, but not the middle. When you open it, you wanna pop the corners open to make it a lot easier. When you actually open it, like I said, I'm gonna go behind it. You are gonna take, is anyone left-handed? Okay, it might be a little trouble for you, but we'll work on it. You take your right hand, there's a paper side and there's a plastic side. Do we see that? Okay. The paper side at the top, we're gonna grab it in our hand like this, right? The plastic side, we are going to open this up, we're gonna peel it. When we peel it, we wanna push our hand forward, and this hand goes straight to our armpit. We're literally gonna rub our arm all the way to our armpit. Does that make sense? So when I open it, it will kind of fly, right? I can open this thing really far. So you open it, and it will just fly away from you, right? I'm 12 inches away, I was 12 inches to the top. Stuff will bounce off your table. It's just gonna happen, right? There's no points off for me on that, right? A trick to have stuff not fall off, these can be thrown away by the way, is when you do it, you can kind of come to the side just a little bit, if you were doing it this way, and you could try to aim for this middle stuff, and it will stop it from like bouncing all the way off your table, right? So again, I'm popping the side, paper in one hand, plastic in the other, straight to my armpit, just like that. And all your stuff goes. Don't be reaching over and trying to drop it straight down because you're getting too close. Also, it's like this, it's not like this. If I open it like this, it's gonna slide down and hit my fingers and hit your table and your whole thing's contaminated. Right, so this is something that we'll practice. I'm gonna keep opening all this stuff just to show you. Again, I'm gonna show you how I'd actually do it. I'd be doing it from the front. Like that. And then you would be, oh yeah, did not do that. You would be checking these after each one. Okay? So after each one, we're gonna grab our peel pack. There's not a hole in it. Off the sides, come over here, open it up, check it, it's good, throw it away. And you would do that for all the stuff, and then eat it also. Checking it. Checking it. The last thing you do is your gown. So the next thing I need to do is my instruments. The outside of this thing is not sterile, the inside is. So I can open it when I'm not sterile. I suggest if you're using one of these to put it on the edge. Because whenever I put my gown and glove on and I am sterile, you have it like this. That part right there, you have to stay 12 inches for. So think how far you have to reach to actually get in there, right? So put it on the edge. You will pop this open. It will have little locks to make sure no one's actually opened it before, so it's still sterile. This is important. When you lift it up, you'll lift it up pretty high. You'll take a step back, and then you'll flip it over. Pretend there's dust all over this thing, right? So if you open this up and you just flip it right here, all the dust is going in, right? If you don't lift it up high enough and you go like this, you're technically contaminating the top of it, right? So we're lifting it up, we're taking a step back, we're flipping it over. There's filters in here, like I was telling you about. You'll take the filters out, you'll check for a hole. These are some weird filters, but it's okay. And we're gonna check for a hole, and then that thing is good. So now, that is sterile, that is sterile, that is sterile, so I'm still not sterile. I cannot be 12 inches from any of that stuff. Does that make sense? Oh yeah, that's right there. Last thing before I scrub is my gown. Take my gown, take it out of the package like I was. I'm cheating to the front, right? Away from me, to the sides. I'll kind of show you something here in a second. Let's say when I open this, it's trying to flop back like this, like it's not all the way down. You can't, or actually let's do this one. Let's say this is trying to flop back up. You can't reach over your gown to like fix this. You need to come to the side or around your gown to pull this back out and get everything where it should be. We can touch an inch from the edge, right? So touching it from the edge, do you see how the corners of the mayo are covered? If it was wrong, it would look like this. because when I put my gown on and I stand right here to put my gloves on, that's too close to my gown. It's 12 inches, or closer than 12 inches. My gloves, I'll take my gloves. Same thing for the toe pack. Did a drop right there, that's good. And then I will do a scrub. Let's do the scrub so everybody can see it. I'll just bring the scrub right down and show you. But on the scrub sink, you have the sink and you have a little ledge. You'll open this up. You'll put this on the top of the ledge. You would grab, and this would all happen in there. Do we all know this would happen in there? Not right here, okay? You would take the little pick. You would turn the water on. Underneath the water, for each finger, you're going underneath every nail. Under the water, right? So if it's this is under the water, then this, all the way, both hands. Then this gets thrown away. Then you grab the scrub brush itself. This gets thrown away. In there. You would take this and put it underneath the water. These already have soap in them. So you would put it under the water, you can get it all soapy. The first thing you would do is you would do your nails on one hand. We're gonna do one arm at a time now. That nail thing is both, and that's it, okay? Start with the bristles. Start with your fingers like this, and you're gonna do 30 on your nails and your nail beds. 30 swipes, basically, right? So you're gonna count to 30. Down and back is 2, right? So if you're counting, when you come down and back as 1, you're gonna end up doing 60. Not wrong, but it's gonna take you twice as long to scrub, right? So we're gonna do 30. Then we're going to move to our fingers, okay? This whole time, when you're scrubbing, your hands have to stay above your elbows. If not, once your hands get wet, if your hands go like this, all the water is coming down off of your fingers, and that's going backwards from the way that we're working, right? We'll start with our thumb. Each finger has 4 sides to it, okay? 1, 2, 3, 4. It has 4 sides to it. Each one of those needs to be done 10 times, okay? We don't need to use the bristle side anymore. So we could go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That makes sense? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Not to confuse you, if you get confused, you see, don't listen. I count to 5, but I just count when I go down and back, right? So I'll go 1, 2, 3, 4, 5, because I really did 10. In between each finger, you have to swipe. So after I do this side, I'll swipe in the webbing of my hand to make sure I can get it. 1, 2, 3, 4, 5, which is really 10. That's 10, that's 10, that's 10. Swipe in between. 10, 10, 10, 10, swipe, 10, 10, 10, 10, swipe. You're kind of understanding 4 sides to it. Okay. After you've done all the fingers, you will go to the back of your hand. We'll do 30 circles on the back of your hand. When you're doing your palm and the back of your hand, we're going in one direction. Don't go back up to your fingers, right? Don't go back up to your fingers. You're staying just on the back of the hand. 30. We'll do the palm. Again, don't go back up to your fingers. It's just the palm. 30 circles. Okay? We'll move to the arm next. Your arm is going to be divided into 2 sections. From your wrist to a little bit above the middle of your forearm. Middle of your forearm to 2 inches above your elbow. If you ever get asked how high do you scrub on your arms, 2 inches above your elbow. Okay? Your arm is like a big finger. There's 4 sides to it, and we will do 10 on each side. So 10, 10, 10, 10. It would be more obvious if this was really soapy because you could see exactly where I'm going. 10, 10, 10. This part back here is the most missed part because you can't see it, right? So make sure you're really getting back there and getting it all. This arm is done. It still needs to stay up here. If my arm was really wet because this was soapy, if I went like this, soap would be going backwards, and that's not what we're trying to do. We're starting from the fingers and working our way up. Before you put this sponge in the other hand, you can get more soap and get it more, well, not more soap, but more water to make it soapy, right? Then we'll switch. What do we do first?
The nails.
How many?
Oh, 30.
Okay, so we'll do 30 on the nails again, right? Then we'll do the thumb. Isn't it fun watching me do this? You see how fast I'm going? I'm counting them all. Like I'm actually doing them all. So it should not take you that long to actually scrub. We're doing the back of the hand. You can do the palm or the back of the hand first. It really doesn't matter. I'm not going to be on you. They're the same level. 30, So that's 30. Same thing, wrist to middle of the forearm to 2 inches above your elbow. You see how my hands are up? I'm not going like this. See that? Okay, so now let's say, you would just throw that away, but now let's say you're done scrubbing, so you need to go and rinse your hands off, okay? So imagine the faucet's coming down right here. When I go, I have to keep my hands up, and I cannot go backwards through the water. I can go through the water as many times as I want, but I cannot go backwards. It'll be really hard to fight at first, because you're gonna be like, oh, right? Through as many times as you want. You're gonna have a lot of soap on your fingers. You're allowed to stay still, but not go backwards. So when you turn the water on, you can just have your hands sitting right here while the water just gets all of your fingers move through. What I see people do is this hand they're not thinking about goes like this. It has to stay up the whole time. Through the water as many times as possible, through it. I'm going through and out, and through and out, over and over and over. And both my, now you don't have to get all of the soap off. Like not, you can have a little bit left, it's fine. We'll go through, and then I'll show you what I look like when I come out. Once my hands are still up, if there's anything dripping, it's coming off my elbows because my arms are correct. Now I'm gonna come dry myself off. I can't touch anything but the towel. I can't go under the towel. I'm grabbing the towel on the top, I'm pinching it, I'm picking it up, and I'm backing up. I would do this facing this way, but I'm gonna show you how to do it. Your towel is a rectangle. You want it to be a wide rectangle, not a tall one, a wide one. Underneath, I'm going with one hand. Whatever hand you're drying is on top. Does that make sense? So this hand is coming down. You can only dry one time. You can't go backwards. It's the same as rinsing off. So I will dry all of my fingers. Then I will dry my hand. And I'm kind of rotating as I go. What I don't want to happen when I get to my elbow is I'm standing straight up and this towel touches me. So as I get up to my elbow, I'm leaning over. You can see I'm just not touching me. I'm leaning over. I come off. I don't want to use the same part of the towel, so I'll go underneath again on the other side. Hand back on top, doing my fingers, hand, working my way to my elbow, like this, and then this thing could be thrown in the trash. And I'm good, right? Hands still up though, because I'm still surgically clean. This is the gown part. I grab the gown. I'm not going underneath the gown. I'm not touching the gloves. The gloves were on top. Jeez. I'm not pushing them over. I'm just grabbing just the gown. Backing up, I would do it this way, but I'm gonna show you this way. There's my smiley face, if you didn't see it. Opening it up, letting it fall down. Putting my sleeves on like this. My hands aren't up, they're out here. Now someone hook me up. My hands are not in the white part. And because I have my mayo facing the correct way, I won't be too close to my table. Your back, even after you've done the card, is not sterile. Your back is, remember we only said you're sterile in certain areas, right? Once you have the gowning and gloving thing down pretty good, just wait till you've done it after the scrub. Because even though I dried off, my hands are still pretty wet. Legit. All right. So I'm going to come over here, take my glove. When I have my glove, there's the word side of my glove, right? It goes down. It's my right glove. It goes on my right hand. The fingers face me. The words go down. The fingers face me. I'm grabbing the cuff. I'm grabbing the cuff. I'm going over the top. Now, when your hands are wet, it's really sticky, but it's still possible. You're pulling just your gown, See how my thumb and my pinky are out? Stop pulling the gown, right? I'm stop pulling the gown. My thumb and my pinky are out. I'm pulling just the glove. You see how high this gown is on my hand? That's what you want. You can fix this stuff later. Don't worry about it yet. We'll grab the other one. Put it on there. Like that. Pull, 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 pull. Just like this. If your hands have all these little things, and these are 7s and I wear an 8, but you can push your fingertips together like this, and then your fingers should be fine. Okay? Now I'm still facing my mayo, and this is when I'm going to do my card. You're my circulator, I guess. Come here. I'm grabbing the left string, holding onto the card. I give it to her. I'm facing this way. She walks around. Don't get too close to my stuff. Thank you. And you need to hold onto the card. Yep. So that's what you have to watch, right? Your job is to set all the sterile stuff up and keep it sterile. Sometimes keeping it sterile means telling people to get away from you, right? Who's helping me though? What do you think is the most sterile part of this whole thing right now? The middle, right? That's what we're gonna grab. So I need to get this off because I gotta do it in a second. So this really should be open. I'm gonna grab the middle. I'm gonna come over. Now we won't probably throw this away in lab because you need this stuff. But when you're gonna do it, don't drop your hand to throw it away. Keep your arm up here and just drop it. Don't drop your hand, just drop it. I'm gonna come over to here. I'm gonna get my stuff where I want it. I'm trying to, remember what I said I want to do with my sterile field? I want to expand it, right? I want to drape that thing. I want that thing in my sterile field. This is your Mayo stand cover. It tells you what to do. It says right hand under this cup. And if you open it, it says left hand under the other one. So if you know your right and your left, you're okay. So I would open this up back here. This is where I see people make mistakes too. Open it up back here. Put your hands where they need to go back here. Then walk over here. Don't do it all like while you're just standing. I'm going to I'll pull it over here so it's easier to see. You see this opening? That's what we want. So you see some people, they put it on like this. You see how I missed? Don't miss, right? Put it on like this. You're going to put your foot on the bottom of the Mayo stand so it doesn't roll away. And then you're going to put your body up against it, right? I'll show you why here in a second. If I don't put my body and I start doing this, look what's going to happen. Is that too low?
Yes.
Yeah, so that's contaminated. So that's why I keep my body up against it while I do this. So as it unrolls, it stays up against me and it stays up top. We put our Mayo cover on. This is higher, even at the lowest level that it goes, because this moves up and down. It's still going to be taller than this, and it's draped all the way around, which means you can grab this. You cannot grab the table. Does that make sense? So, after I've done this, I have all this excess and it's still moving around. You can lift up this inner tray. You'll see on the Mayo, but it has a little inner tray. You lift it up. You can tuck all that excess. It also makes it not move. I want a little bit more protection on there, so I'm going to take a towel and I'm going to put it on top. I'm going to turn it around. Now that I've expanded it as much as I can, I want to shrink everything down. So now I want everything where I can see it. If you leave your Mayo straggling over here while you're working over here, she can come touch my stuff again, right? But you're going to bring it over here. Huh? Is it too high? What did you say? Oh, is it too high?
You know, are you saying like that one can touch that one within the same level?
Well, it's the table height and above is good.
Oh.
Yeah. So that's good. I mean, technically, like even that borderline, but probably good. This is with it all the way down. See, it's still above it, right? So the next thing is, you know how I put a towel on here to protect it? I want to put towels on my back table. So everything I have is going to go on this tray. And it's going to go on my Mayo. I'm going to take some towels. I'm going to do it on the other side so you can see, but you can do it from this side. You're going to open these towels. Remember, we don't flop anything, right? Open it up, place it on the edge, come over here, place it on the edge, and that's what we want to do. If you are not paying attention, if you flop, you're going to go like this, and you're going to pull it up. What did you just do?
Contaminated.
Your whole table's contaminated now, right? So that's why I said place it on the edge, because even if I accidentally pull it while I'm doing this side, it was never over the edge, so it doesn't matter, right? So we're just placing these all the way down. And it's okay if they overlap, we just want to make sure that we're covering the entire table. So now that that's done, we can start setting up our table. We need to know which patient that we're using, right? In the middle, you have options. We're going to say this does not exist, this patient. Our patient is this one. So we need to set everything up on the opposite side of the patient because we're going to end up moving this over next to the patient when we do the surgery, okay? So we're going to take all of our stuff and put it where it goes. You'll learn where it goes. I'm taking my Bovie. So this is the Bovie. So this is what they use to cauterize the patient, right? They can cut and coagulate. I take it and I flip it over to where the tip is sticking up. This is a countable item. We have to count this to make sure we don't lose it because it comes out, right? To make that easier on ourselves, we flip it over, we put it on the edge, because we're gonna put more stuff in there, and this will stick out, and we can see that we have it. It's easy to count. I'll take my drape. I'll put it on top of there. My surgeon gown will go over there in a second. All of this stuff goes here. I'm gonna make some towels. So these are drape towels. I would do it right there, but I'm just showing you. You're gonna do 3 towels towards you and 3 away. What I mean is when I open it up, I'm either gonna flap this top towards me or flap it away. Does that make sense? They're gonna be towards me or away. So 3 towards, so there's 1. Open up the next one. There's 2. There's a 3rd one towards me. There's 1 more away from me. This whole thing, and I'll show you how to do this. It looks harder than it is. You'll flip this all towards you. You'll put it on top of there. That's your drape towels. We'll use that before we put the drape on. We'll take our surgeon's gown. We put our surgeon gloves underneath, gown on top, and then give the surgeon a towel to be able to dry off with. This is all in reverse order because when the doctor comes in, they're going to want to dry their hands. Then you're going to put the gown on them. Then they're going to want the gloves. Then they're going to want the drape towel. Then they're going to want the drape. Then they're going to want the suction and the Bovie to go on top of the drape. So you're putting it all backwards, basically, right? We're done with this tray, so I'm going to take the tray. Whenever you're sterile and you're handing something to someone not sterile, you're on top, right? That way nothing can fall onto you. So I came over to my circulator, I'm on top, I hand her that, and I'm good to go, right? You just hold it. Pretty much this is all set up how it should be. This side of my table is called the working side. This is the side that's going to be closest to the patient. I'm going to come get my instruments. When I grab the instruments, I don't want to grab the handles like this because I'm risking hitting the top of this thing, which we don't want to do, okay? We want to grab like this. So I'm going to reach in, I'm staying 12 inches away. I'm going to lift this up. If there's a filter, she'll check the filter. If not, she's going to check for any water. Good? Okay, what you don't want to do is put this up against you because if there was water, I got to change everything. If there was water and I'm like this, I only have to change my gloves. But nothing's wrong, so I'm going to come over here. I'm going to put it down. I'm going to take a towel. I guess I'll do it on this side again. I take my towel, and I'll show you how to make this, but you're folding it. You're basically making your roll towel. This is the thing that's going to hold all of your instruments. You'll go in front of your instruments like that. Again, I would be doing all that. I would be doing nothing from back there. Everything's from here, just to show you. Do we see how all of these are curved in kind of in the same direction, the ones that are curved? The curves need to go towards the working side of my patient, right? So, the curves are all facing that way. The reason for that is, these first few instruments all stop bleeding. So if I'm in a situation where I'm working like this, the closest instruments to me stop bleeding. Does that make sense? We're going to get into the rest of how to set that up, yeah.
What about if the closest instrument to you are not stopping the bleeding? Because everybody doesn't go from bottom up or bottom down. Meaning like the way they put it on there.
Well, technically, it's sterile, pretty much. I'm not missing anything. That's your final right there. Here. After we've gowned and gloved the surgeon, and then this patient has a drape on them, right? The next thing you do is grab your Mayo, and this would have instruments you know you for sure are going to need during the surgery. This Mayo will come all the way over here like this, and it will go right here. And then your table, you'll start from the top, and you'll pull it, and it goes just right here.
And this is part of the final or not?
No. This is when we start doing surgeries.
Okay.
That way. This is a hemostat. This is a Kelly. This is a Coker. This is a Babcock. This is a Schnitt or a tonsil. This is an Alice. This is an Army Navy. This is a Wheatlander. This is a sponge stick made from a Raytech and a ring forceps. This is a DeBakey. These are Metzenbaum scissors. These are straight Mayo scissors. These are Astonwood teeth. And then this is a Sin Ragnell. This is the Sin. This is the Ragnell.